Thank you, Steve, and I'd like to thank the organising committee for allowing me to present our work on the Carers Alert Thermometer, or CAT as we refer to it, in identifying support needs of family carers of people living with motor neuron disease. Just some brief background, what to expect from me this morning. I'm going to give you some background information to give context to the CAT development, and also some details on the project undertaken to develop the CAT. Talk about the pilot that we've conducted with the Motor Neuron Disease Association, and say where we're going to from here. So previous work that we did in our local area in the northwest of England confirmed that carer burden was impacting on patients at the end of life, resulting in unwanted and often unnecessary hospital admissions. Carers had unmet needs which were impacting on them in various ways, affecting their ability to provide the type and level of care that was required. Now, clearly, supporting carers is seen as important, and the publication of numerous policies and strategies on the subject has ensured that doing something was seen as a priority both nationally and internationally. What was apparent from our earlier work, though, was that issues facing carers at this time could have been addressed had supportive interventions been introduced in a timely manner. What was missing, though, was a simple way for non-specialist staff to be alerted to carers potentially in need of additional support. There were no appropriate tools for use in everyday practice available. The tools that were available were either too long, had too many domains, and so were quite complicated to complete. They weren't evidence-based in their development or construction, and they weren't focused at a generalist audience. They tended to be focused at specialist staff who had additional education or training provided. So there was a need to develop an alert intervention specific to carer needs that could be incorporated into routine, everyday practice, that could be delivered by general healthcare staff or volunteers, because we often find that these people have most frequent contact with patients and carers in their own homes. So just some clarification on what we mean by a carer. In the UK, that definition covers a broad range from people who are paid, who are employed to go into the home to care for somebody, or it could be an informal carer, a member of family or a friend. The term family carer is often used in the UK. A conservative estimate is that there are 6.5 million known family carers in the UK. But many carers are actually hidden to health and social care services, often because they don't regard themselves as a carer. 500,000 of those being cared for will die within the year. And quite staggeringly, the care provided by carers is worth an estimated £119 billion per year in the UK. So to put that into context, if that care was to be funded, if those carers were to be paid for the work that they're doing, it would cost the state £119 billion per year just in the UK. So the study to develop the CAT was conducted during 2010 and 2011 and had a number of aims that you can see on the screen now. I'm not going to dwell on these for too long because otherwise Steve will be on the stage tapping away at me. The study was conducted across 5 phases, and again, I'm not going to dwell on these. We've had a number of papers published on the study. They're all available through open access via the project website, and I'll put the web address up at the end. But I just wanted to say that 245 people were included in the study, so this isn't a small-scale study. That was 117 carers and former carers, and 128 health and social care professionals. And that's just to demonstrate the robust evidence-based approach to the development of the CAT. So what is the cat? Well, essentially, it's a page of A4 printed on both sides, and you see them here side to side, so you can see everything. The cat is available free of charge from our project website, along with other resources, including guidance notes for the assessors. It's designed to be used with unpaid family carers over the age of 18. And essentially, it's a collaborative process that's conducted with the assessor and the carer to identify, or to alert the assessor rather, to the carer's needs in relation to two particular aspects. So it's the carer's needs in relation to their caring role, as well as the carer's needs in relation to their own health and well-being. So the cat contains some simple instructions as a reminder to the assessor. It allows the recording of demographic details, and there are 10 alert questions, which are rated on an alert scale from low to intermediate to high. The level of need is recorded on a thermometer scale as a visual reminder. So the total number of intermediate and high alerts are circled on that thermometer. On the back, we have suggested next steps, which provide guidance to the assessor, and these can be personalised to local services. There's a record of the agreed plan of action to facilitate the right assessment or support for the carer, and a data review which is determined by the level of identified need. So where are we now? Well, we actually launched the CAT officially in September 2014. It's being used in a number of countries worldwide and promoted as a resource, and we're conducting a number of pilots currently. So on to the work that we've done with the MND Association. The MND Association Carer Survey last year aimed to understand more about what it's like to be a carer of somebody living with MND. And as the survey shows, the emotional impact of caring for a person with MND is significant and complex. Findings from the survey indicate key concerns for carers, which reflect our previous work and also other published findings. The MND Association has a mission to improve the support and care received by carers, and wanted to review the CAT and pilot it with family carers of people living with MND to determine its usefulness in identifying their need for support. We held an initial workshop in the southwest of England, around the Bristol area, for those of you who know it, followed by a second workshop in the northwest of England, and that was the area covered by Greater Manchester, Merseyside, Cheshire, Lancashire. It's a small-scale pilot, and so far a total of 22 people have attended workshops. 18 of them are association visitors. And I'd like to thank Louise, who earlier on described the role of association visitors, so she saved me a little bit of time there. So briefly, the programme for the workshop comprised of what's on the screen at the moment. And again, I'm not going to go into that in too much detail. We did receive feedback from the workshops, and some of it is on the screen at the moment. Now, some of that relates to the use of the CAT, some of it to the format of the CAT, and some related to the actual workshop itself. And wherever possible, we took on board the comments and introduced it into subsequent workshops, or actually altered the CAT itself to comply with what people had suggested. Around 3 months after the workshop, participants were contacted to complete an online survey of their experiences to date. And this is standard practice for anyone who registers to use the CAT, because we really want to monitor the impact of the CAT over time. This work is still ongoing, and to date, out of the 22 participants, we've had 14 who've completed the survey. Of those 14, 7 have used the CAT, with 14 carers. The carers have a range of ages from 36 to 76 plus. And we ask one question asking how useful participants have found using the cat. And the average rating is 7 out of 10 for usefulness. So at the end of the survey, participants were asked if they'd like to be interviewed in order to elaborate on their experiences. And so far, we've conducted 7 interviews. But this work is ongoing and additional interviews are scheduled, but unfortunately couldn't be accommodated before now. So there are some distinct benefits noted. Our participants told us that it provides a structured approach so that they know how they can introduce the topic of carer needs and ask questions that are specific to that carer. It's clear and simple to use and doesn't require additional or extensive training. Importantly, it's focused on the carer and acknowledges their needs. And also, it can be used to join up with other service providers and provides an evidence base of carers' needs that can be put forward to other services, such as social services. There have been challenges, and not all of the participants have been able to use the cat so far. Some have found it difficult to get time with the carer to complete it. And one of our participants was actually quite inventive and took the carer out of the home situation so that they had some private time together. Some participants had commented about paperwork, and more paperwork can be an issue. I think that comes back into the time element as well. Some of the AVs viewed their role more as a friend or almost as part of the family. And although they were not unwilling to use the cat, they felt that maybe filling in forms was not necessarily part of their role as they viewed it. And of course, some people who provide care are uncomfortable with the term carer and don't actually recognise themselves as such. So trying to complete a carer alert with them could be difficult. So where to from here? Well, we need to complete the evaluation, and as I've said, more interviews are scheduled. We're exploring the potential to engage north of the border with colleagues in Scotland. But a key point that I want to get across is that there was considerable support for the use of the cat. Helping to identify carers' needs was viewed as a priority, and the cat was seen as a very useful tool in that regard. Acknowledging that changing practice can be different, some of our interviewees suggested that the cat might be best used with new AVs or with new referrals where there isn't already an established relationship. And I suppose this comes back to how they perceive their roles, not as healthcare professionals, but as a family friend. So certainly the idea of it being introduced as part of initial AV training rather than a change in practice is something that's worth exploring. And as I said, we do have a project website, and the email address is there, where there are published papers, open access papers, and associated documents, resources that might be of use or interest. Thank you.
Thank you, Mary. So we do have time for questions. So again, please just raise your hand if you have a question. Yeah, I've got one over at the back, please.
Hello, I'm Juliet Colt from Nottingham. My question really relates to what happens afterwards. So you fill in the paperwork, and that's probably quite a useful exercise at that time. Have you found when recommendations have been made that more help is needed, that that's followed through by any of the other services?
That is part, if I just go back on my slides to show you the cat. So we do have in section 4 the plan of action, and this is where you would specify. Can't see with one pair of glasses. I have to try this. And that details what should happen. So who would be responsible for any action that needs to be taken, and what those particular steps would be.
I suppose the question is whether you've actually looked to see whether they have been followed through. It's all very well having a set of this is what's needed, but is that being picked up by those other services?
And I think that will come through in the evaluation
Okay.
as it progresses.
Thank you.
Further questions? Yeah, I've got one at the front.
Thank you. Pablo Aquino from the ALS Association of Argentina. I was wondering, after your assessment of the CAT, or the conclusion of the CAT, you came up or are planning to come up with some sort of manual for carers, maybe in collaboration with the MND Association of the UK, and if that is going to be accessible some way?
What sort of manual?
Yeah, some sort of manual for carers, maybe as a result of the survey you conducted, or if you are planning to do so.
So perhaps I could answer that one, Pablo, because the MND Association, we do already publish a carer guide, and it's an award-winning one and is quite available through our own website.
Great, great. Thank you.
Other questions? It's really hard to see with these lights. Is there any other questions? No? Okay, well, join me again then in thanking Mary for that presentation. Thank you, Mary.